outside, but you can't neglect to brush the biting surface of the teeth. Of course, our mouths don't open this wide, but you want to brush the biting surfaces of the teeth all the way around the lower, and then don't forget the inside surface. So in this area, all the way around. This lower area in the front for most people is a very, very hard area to get into. So sometimes you need to take your brush and go like this in order to do a very good job. But remember, a toothbrush can't clean an area of a tooth that it doesn't touch. So it's your job to really work to get to every area. And these third molars back here in the back are tough to get to. So one thing you can do is close your mouth a little bit. It makes a little bit more space. And if you move your jaw from one to the side that you're trying to brush, it creates even more space for the brush so you can get up in there and get around to that whole tooth. Also, don't neglect the back side of these back molars, which can be a tough reach. So those are these areas here and on the back of the molars, inside and out, and especially down by the tongue here, are areas we see people neglect that I really encourage people to try to reach.
Let's show that one more time, please, how you brush the teeth.
You hold the brush at a 45-degree angle. There we go. 45-degree angle to the gums, which would be right in here, and wiggle it about 10 times and then brush towards the biting surface. And then come up here, 45-degree angle, and brush towards the biting surface.
But that's going to be a pretty slow process, by the way, this way.
It is. It is. To do it well and to get a thorough brushing job done, it takes about 2 minutes.
2 minutes.
And I don't know how many of us spend that much time.
I spend 3 minutes, seriously.
Really?
Seriously,
That's
3
good
minutes.
to hear.
But I do a circle way. The circle way.
The circle way, I think, can be beneficial as long as you're not getting too much of in the circles, as long as the circles are small and you're not running across the teeth in big circles. Because running across the teeth in big circles can lead to going this way more than you really think you are. So be careful that the circles are small and there's not a lot of lateral motion.
What about little kids? I mean, since their teeth are very tiny, and sometimes toothbrushes are a little bigger for their teeth.
They do
Is it
make
the same technique?
It is the same technique, but they use child-sized brushes, and we recommend that you use a brush small enough to reach those spaces in a child's mouth. We also recommend that parents help by getting in there at least once a day and doing a thorough brushing. With smaller children, it's been suggested that you can do a head in your lap type of situation, lay them down on a bed so you can get them upside down, and when you do that, you can see more in their mouth than if they're standing in front of you. You can even brush their teeth with a dry brush. You don't have to use toothpaste, especially on small children. It's just the mechanical motion of the toothbrush removing the debris and any food that's stuck to the teeth. So the main thing to remember is once you're done brushing your teeth, take a look and make sure that there isn't any debris. Use your fingernail if you have to, just to check and make sure that the surface is smooth and clean.
This is the only station we have here in town that we're going to offer free dental. So if you want to clean your teeth, in fact, let me get this out of the way. We do root canals, extractions, fillings, cleaning, and partial denture.
Not very many partial dentures, but
not many. So all that's going to be done for free, and the only time it's going to be done, I'm going to give you the day and the time as well as the date close to the end of the show. This way, so you could keep watching the show. Indicators. You know, some toothbrushes do have indicators on them.
Yes.
Are those true indicators?
You know, I think that they determine how much the toothbrush has been used, and the
Wet?
reason, right, how
wet?
much it's been used and how much it has been in the mouth.
Right.
And that's a good thing because we want you to change toothbrushes about every 3 months, because if you think about all the bacteria in your mouth, then you put a brush in there and you brush with it, you're transferring a lot of that bacteria onto the brush. And that's going to grow when you're not around. Even though the toothbrush may have a chance to dry out, there's still bacteria growing in there. So once that is going on, you want to get rid of that. You also want to change brushes after you've had an illness. If you've had, you know, bronchitis or some kind of illness that is contagious, you want to change brushes after you've recovered from that, because you don't want to keep recycling those same germs or virus back into your mouth. So a new brush is an important thing.
So how often do we need to change those brushes? Once every 3-4 months?
We say, barring anything like an illness, every 3 months is about right.
Same thing with the brushes. Is same thing with toothpaste. I mean, there is like 50 different types of toothpaste from $1.50 to $5 toothpaste with different smells, different flavors. You know, nowadays you see the word whitening, big bold writing, so attracts people to buy that specific toothpaste. What's your advice?
My advice on toothpaste is use what works for you, because as with toothbrushes, whatever works for you is the best thing for you. It's not going to work if you're not using it. So first of all, it should be something you like. The second thing I recommend is that you look for the ADA seal of approval, because we do want you to use something that has fluoride and other protective ingredients that are going to help strengthen the teeth and hopefully decrease the amount of decay or cavities that you develop over time. So barring anything else, any other bells and whistles that they put in toothpaste, we're looking for a fluoride toothpaste with the ADA seal of approval.
What about what's actually in the toothpaste itself that makes it a good or not recommended toothpaste?
Well, I would say the fluoride is
The
the main thing we're looking for. Toothpastes are made up of abrasives to help remove the plaque and debris from the teeth, as well as other ingredients like the fluoride to help strengthen the teeth, as well as flavorings and other things that can be helpful but are not always necessary.
So those toothpaste that says whitening or
Yes.
whites the teeth, are they really whitening the teeth?
If they have the ADA seal approval, they have passed certain tests that will give them the statement that they work. They work in a way that's been determined by the ADA and has been tested. So yes, they do work. They're not as efficient as some other things, and a lot of times they're more abrasive. So if we have someone coming in with general sensitivity in the mouth, we look for two things. We look for, are they using a toothpaste that's whitening, because the increased abrasiveness in the toothpaste can cause them to be more sensitive. We can also ask about different flavorings. Cinnamon is a very sensitive flavoring. So artificial cinnamon is something, if you're having a lot of sensitivity in the gums and in the mouth, we check for that also.
Sensodyne, I think it's called.
Sensodyne is
For Sensodyne, okay.
Sensodyne is a very good sensitivity toothpaste. I think Crest and Colgate have also come out with their own sensitivity toothpaste.
Right. And it works?
Yes, and those usually have ingredients such as stannous fluoride, which basically incorporates some healthy minerals into the surface of the tooth to try to block the nerve from being stimulated, because all a tooth feels is pain. So if they can block those tubules so the nerve isn't being stimulated, they can decrease the sensitivity.
Again, we are with Dr. Meng, Sara Meng. If you would like to be a part of the show, please call us at 267-8855, 267-8855. And we have caller number one. Good evening.
Hello.
How are you?
Yeah, fine. My name is Muhammad Shinwari.
Assalamu alaikum.
Nabil, let me ask you a quick question. You used to work for York International one time, right?
6 years ago, yes.
Yes, I was there too as a manufacturing engineer. Anyway, I have a question for the doctor. You are a doctor too, but the dentist doctor. Is there any cure for receding gum? Can you buy something, use it where the gum go back to the original form or close to it?
There is not something that you can buy, but there are treatments that can be used to treat that. Normally, we refer you to a periodontist who is a specialist in the area of gums and the bone that supports the tooth. And they can do procedures which include, but are not limited to, things like grafting, using gum tissue from another part of the mouth or another source in order to shore up or plump up that area or get coverage of the root. So basically they put the gum tissue back, and then they will counsel you about how to maintain that and also talk to you about what other needs you might have, because gum recession can be a sign of brushing too vigorously. It can also be a sign that you've had some bone loss, which is called periodontal disease. So I would encourage you to seek dental care from a professional and see what they may have to say about it.
All right, thank you very much.
You're
Thanks,
very
Muhammad.
welcome. Thanks for the question.
Bye.
He said his name Muhammad reminds me with a question in the Arab days back in about 1400 years ago, as well as today. Some Muslims actually are still using what we call a miswak. A miswak is like a thin type of a little stick, like a branch of a tree, and they brush their teeth with that miswak. It's a piece of wood, actually. They cut the tips of it, and becomes like a toothbrush.
Yes.
But it has some type of a flavor, taste like, and it does clean the teeth. Have you studied anything in your being a dentist?
I have, and back in dental school, I do remember studying something of this nature, and I think that it works well because of the mechanical motion.
I see.
But it also could have some of the essential oils that are healthy to the teeth. And those
That's
essential
amazing.
oils are something that today you might be more familiar with in the form of Listerine. It has essential oils that are, very helpful in keeping the teeth and gums healthy.
That's amazing. What about flossing?
Flossing is very